morning.
Thank you very much for joining us. A lot of people sort of agree with me in saying that why should we, the people, well, I say we, the people, you might say I'm one of them who should be given 400 quid to lose weight, but why should people who don't need to lose weight subsidise those who do? And why should the NHS use taxpayers' money to do it?
Well, I suppose the big question on the money is choose when you want to pay, because we know that bariatric surgery costs nearly £10,000. We know that a month's supply of the new weight loss drug Wegovy is £200 a month. And this is an alternative that, if is effective, would be cheaper than the alternatives that we would pay. We also know that we have big waiting lists on our NHS. Cancer care is very expensive. Heart disease care is very expensive. Diabetes care is very expensive. So whilst I can understand that concern that people are raising about the cost, the point is choose when we pay the cost.
Yes.
And a lot of these programs...
There's a double-edged sword there, though, isn't it? Because the two things that you said were the alternative are also things which we pay for people who are overweight to fix their being overweight. You know, giving them Wegovy is not really a cure for being fat. It just stops you from eating. You know, so it's a sort of a very modern-day acceptance that obesity is somehow a disease like cancer, which a lot of people don't think it is.
I'm sure a lot of people don't think it is, but the World Health Organization think it is.
Yeah, so I don't really care what the World Health Organization thinks. But the point of the matter is that it's only been declared a disease relatively recently, and most people who are obese because they have no self-control, surely.
So I guess if we start to think about those diseases, you would, I hope anyway, you wouldn't say the same about people suffering from cancer.
Of course not, because cancer is a disease. Cancer is something for which you have no control over. You don't have control over getting cancer.
But you yourself have just outlined that obesity is a disease, and only recently...
No, I don't think it is. I'm saying it's different.
No, I understand that you don't think it is. But
well, you have control over it, don't you? I mean, people are obese because they have no control over what they eat and the exercise that they do.
So why do people suffer from cancer then?
Well, you get cancer because it's a disease. Nobody knows. If you knew how you got cancer, that would be a great step forward in the way that we treat it. But nobody knows. Okay, but what I can tell you is 1 in 2 people now get cancer. Some people are able to get it treated and some people are not. But it's a treated disease. Obesity isn't.
But if you look on the Cancer Research UK website, 60% of cancers are related to lifestyle factors, just like obesity.
They think that, but they don't know that, do they?
They do know that. That's what the evidence says. It's really clear. So if we're going to talk about evidence rather than judging people, which is what I'm really about, what we're about is let's talk about diseases and let's talk about heart disease, cancer and obesity. Right. And the causes of the 3 diseases are the same. They're genetic, they're biological and they're lifestyle, all of them.
So that's 3 possible ways you can get cancer then?
Pardon?
That's 3. So that's 3 possible different ways that you can get. So it's not all about lifestyle, is it? You can have a great lifestyle and you can still get cancer, but you can have a bad lifestyle and you can not be obese.
Correct. And so that's the point. That 60% of cancers are related to lifestyle factors. So I've got no problem. If you want to judge people living with obesity, then judge people. I'm
not judging anybody. I'm just saying I don't want to keep paying money for people who could fix the problem they've got themselves without taking money from those who don't need to do it.
And as I've said, if we look at those 3 diseases, the determinants of those 3 diseases are the same. But
I don't think they are. I think people will be really offended, particularly cancer victims, of you saying that people who are obese have got the same disease that people who've got cancer. I think that's quite shameful, actually. But anyway, we're out of time. We'll talk to you another time. Paul Gately, thank you very much indeed.